Hello everybody, welcome to Kavish IAS Converting Possibilities into Reality. Today we are going to be continuing with the third sustainable development goal, which is maintaining good health and well-being. So as we are continuing with the third goal, we are going to be discussing a little bit about the scenario of global health at this point. As we know that ensuring good health and promotion of well-being at all ages and in all forms is very essential if we want to live a very happy and healthy and most importantly sustainable life. So maintaining good health and also not just physical good health, also maintaining a mental good health is very important if we want to prosper well in all spheres of our life, if we want to engage ourselves actively in society and cultural aspects also. So we have seen that in the recent times, the COVID-19 pandemic that has taken place, it has destabilized the global health conditions, hygiene, economy, and most importantly, survival has been disrupted in all manners. So this COVID-19 pandemic has revealed some very remarkable infrastructural flaws that we will go through in details a little bit later. But first we will see that before the pandemic there were certain significant efforts that were given towards increasing life expectancy or reducing the infant and maternal mortality or improving the women's sanitation conditions. So at a global level, there were significant efforts that were given by many other countries, not just India, at a global level in maintaining good public health. And there were significant efforts and achievements that has taken place, and life expectancy has increased if we compare it to suppose the 1900s level, and also the infant mortality rate or the maternal mortality rate, these have also fallen down by huge margins, and the women's sanitation conditions have also increased. We have seen that there are more awareness and campaigns related to menstrual hygiene, and menstrual hygiene products are there are more innovative products, right? We have seen in the markets nowadays there is more awareness amongst women and men. So these are some of the most important efforts and achievements that happened in the health sector. Apart from that, the COVID-19 pandemic had revealed some very remarkable disparities in the countries, which revealed the fact that different countries coped with the pandemic in different situation. For example, in China, there was one kind of a situation. In India, there was one kind of a situation. Whereas in countries like Brazil or maybe the Middle Eastern countries or so there were many countries which required a lot of external help. They did not have many of the infrastructure facilities, and there were other countries which were more like self-sufficient and self-reliant. So there were huge disparities that has been revealed. Next, we will see in details what exactly this SDG 3 is all about. So, as we know, under the 17 Sustainable Development Goals, the SDG 3, it stands for promotion of healthy lives and well-being for all at all stages. So, what does this goal address? The goal addresses all major health priorities including reproductive health, or be it the maternal and child health, or combating communicable diseases or non-communicable diseases, or promotion of universal health coverage, so that the most poor and vulnerable sections of the society, they also get access to safe and effective medicines and vaccines, so that affordability, this is a great factor, affordability is maintained. Affordability is a very important criteria. So this is what the universal health coverage ensures. And definitely it also calls for more research and development in the health sector and better health financing, and also strengthening the capacity to avoid risk, health risk and management. For example, the COVID-19 pandemic was definitely a global risk and threat. So that the infrastructure can be developed for when very suddenly a pandemic or any kind of a situation arises, we are more sustained to combat the situation. So these are all the goals under the sustainable development goal. So now we will see that what are the achievements that has been made at global level. So there are remarkable success which has been seen in improving the child and maternal health, also infant health, life expectancy has increased, maternal mortality has lowered by 505 since 1990s level, and under 5 mortality has also fallen to only 39 deaths per 1000 live births in 2007 as compared to 2000, the year 2000's level, almost 50% reduction has been seen in under 5 mortality rate. Apart from that, the global neonatal mortality rate has also reduced by almost 41% since 2000. However, there are certain spheres of healthcare where these kind of achievements have not been seen yet. Rather, we can say that there are some threats which are increasing. For example, the risk of cancer is increasing, be it the cervical or breast cancers for women, or the cardiovascular diseases. As we know, heart attacks and strokes, they are also on the rise and they stay high at around 18%. And as you know that the climate or the global climate is very much deteriorating, we have seen that the AQI index, okay, the AQI index, they have one of the most worst situations. They reveal one of the most worst situations when we see reports of cities like, be it Delhi, be it Kolkata, be it Mumbai. They have very bad air issues. The pollutants are increasing and there are increasing risk of respiratory threat. This is on the rise. So this is a very important thing. Now we will see that what is the situation in Indian scenario. So India has progressed in reducing the MMR by almost 78% as compared to the 1990s level. And there are states like Kerala, Maharashtra, Tamil Nadu, they have already reached the SDG 3 target of deaths less than 70 per 1 lakh live births. So this is definitely a commendable situation where 3 states have already reached the SDG 3 target. And another achievement is that under 5 mortality has also fallen by almost 37% since the 2012 level as per the SRS report. And gender gap in under 5 mortality has also fallen from 9.3% to 2.7%. So the gender gap has also reduced a lot under 5 mortality. Apart from that, there are other campaigns which are launched. For example, the Beti Bachao Beti Padhao movement. This has been launched to promote the girl child education. Apart from that, the vaccination coverage increased, of course, under Mission Indradhanush, as we know, universal immunization program, where almost 90% of children are supposed to get free of cost immunization. All the vaccines, all the important immunizations are going to be delivered free of cost under Mission Indradhanush program. And also the menstrual hygiene campaigns have been launched. In 2018 a movie came by the name of Padman. So under Swachh Bharat Abhiyan also some menstrual campaigns have been we have seen. So these are indeed very remarkable achievements in the Indian scenario. But the thing is, the COVID-19 pandemic has revealed some infrastructural flaws when it comes to the public investment in the healthcare sector, which is seen only 1 to 2% of GDP is spent by the Indian government on the healthcare system. So this is indeed a very disappointing scenario, because as we compare it to the global average is around 5.4%, This is the global average. So when we compare it to the global average, we see that India spends very low. If we compare it to the developing nations of Southeast Asia, for example, in Thailand, they are also the government expenditure on public healthcare is much higher as compared to India. So this is something that needs to be improved. So this is now where how we now go to the what are the causes of poor healthcare. So as we said that the poor healthcare financing is something that needs great improvement. Okay, so we have seen that under the national health policy that was launched, okay, the national health policy, it was mandated that 2.5% of GDP must be invested in public health. But that figure is not always maintained. Although in 2017 to 18, around 3 to 4% was 3 to 4% of the GDP was spent in back in 2017 to 18 on that year. But there has not been a case of consistency. So this is something that needs great improvement from the government sector. And apart from that, there is also inadequate access to basic healthcare, especially in the rural situation. There is a huge lack in professionals. We can see that there are very scarce hospital beds or the ventilators, as we have seen in the pandemic situation also. If we compare with rural and urban, we can see that 78% of doctors, they directly cater to only urban population. Okay, so you can see the stark contrast in the rural and urban situation. So of course there is a shortage in the professionals and the medical experts. Apart from that, there is lack of political will. Of course, there are many different kind of government schemes that are run by the state and the center government. So when it comes to so many government schemes, there almost always is a situation of overlap. For example, the state is launching a different kind of scheme and the center is also launching a different kind of scheme. So sometimes the beneficiaries are also very confused so as to which schemes they must avail. And apart from that, the implementation of the government schemes is also another situation. There are also some proofs of corruption that takes place in implementing the policies. Apart from that, there is a huge issue of only a handful Indians having health insurance. So most Indians have to spend huge amount of money for the medical expenditure out of the pocket. So this is known as out of pocket expenditure, which most Indians have to bear the brunt of carrying the medical and health expenses, and they don't have enough insurance, and which is why they have to bear the brunt of this high cost of the private sectors, the private hospitals also. So this is something which needs to be amended. Then we will see that there is a lack of preparedness when it comes to battling emergencies. We have seen in the COVID-19 pandemic situation also, different states of India, they had different infrastructural situation. For example, Kerala handled the situation quite, in a better way as compared to other states. So different states have different levels of preparedness. That is also one thing. All states are not prepared or equipped with all kinds of equipments. For example, the ventilators or the oxygen cylinders or the ICU beds, these are not available all over India at a good way, in a good rate. And the last thing is that there is a lack of organized medical history of patients. So if a patient has some previous medical records and they have taken some test and all that, so a patient does not have all the details recorded somewhere. So there is a lot of time delay also when it comes to, you know, the doctor's diagnosis. So you can see that the reason why healthcare system is lagging, there are multiple situations which has caused this kind of poor situation. Then we will see what are the government initiatives that has taken place, that the government has launched. Most important is that we have seen that the National Health Mission is that this was launched back in 2013, and this envisaged on the achievement of the universal access to equitable, affordable and quality healthcare services, with goals to reduce the MMR, IMR, TFR and the anemia like conditions in women aged 15 to 49, and malaria, leprosy incidences and several other goals were also mandated under the National Health Mission. So this is one of the most revolutionary, schemes that has been launched under in recent times. So National Health Mission has many goals, and most also, when it comes to reducing the MMRs, IMR and TFRs, we had seen in some previous slides that India has actually done some good achievement when it comes to reducing the MMRs and IMRs and TFRs. Apart from that, there is this Ayushman Bharat, which promotes the creation of healthcare centers, health and wellness centers. As we know that in UP, the situation is such that only one primary healthcare center was there for every 28 villages. Now, can you imagine such a situation that only one primary healthcare center was there for all the people who lived in the 28 villages? So, Ayushman Bharat is such a program which improved the situation, and it emphasized on creation of wellness centers all throughout India. And also we will see that the Pradhan Mantri Jan Arodhya Yojana, it tackles the issue of the medical insurance. It gives insurance of 5 lakhs per family for secondary healthcare. So this is one important thing that under the government initiatives. Next is that the drug resistant TB treatment centers have also increased from 197 to 509 in the past years. And there are programs like the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases and Strokes that have been launched in recent times. Apart from that, we have also seen that the National Rare Disease Policy, this was launched very recently in 2021 to tackle the rare diseases for which there are no approved treatment. Okay, and what are these diseases? There are some diseases which are very rare. For example, lysosomal storage disorder, or it may be hemophilia. So these diseases are very rare. Sometimes they happen in 1 in 5,000 cases or 1 in 10,000 cases. So the most dangerous situation is that there is no approved healthcare structure or system, or no treatment is available for these kind of diseases. So the national rare disease policy has been launched to identify the kind of diseases that fall under this sector, and so that these kind of diseases can be somehow they can be tackled better, research and development can be promoted. We know that the mental health is something also that is on the rise. The mental health issues, for example the depression or anxiety attacks, or there are many situations of the suicide cases are also, these are on the rise. Also the vulnerable senior citizens, also there has been many cases of increment in the elderly suicides that are taking place in India. So to help that, to support that situation, the Mental Health Care Act has been launched, and also the National Mental Health Program has been launched. Now these were some of the very significant government initiatives that has taken place. So now we will see that what are the other situations or other efforts that can be given to improve the particular this conditions of ailing healthcare system. How can we strengthen the healthcare? So we will need to see that the public expenditure on healthcare, that is definitely improved. This needs to be a very important effort taken up by the government, and also the private sector. The private sector also needs to contribute to the ailing situation of the healthcare system in India. So a cooperation needs to be mandated between the public and the private sector, so that there is effective engagement in promoting better health, and ensuring that good health and good public health is maintained. And the thing is, there is a need to strengthen the urban local bodies. For example, if we are talking about better financial allocation, okay, there has to be more financial allocation by the center, and there has to be a good cooperation between the center and state also when it comes to strengthening the local bodies, because health after all is a state subject. So there has to be good cooperation between the center and the state. And apart from that, proper utilization of the talent pool by training and reskilling. This is also another important thing, because India, has so many doctors coming out every year. So we need to